You look at a lot of medical devices, they're clinically validated, they're FDA cleared, but they probably fall short on kind of the patient's needs. And then you look at a lot of wellness devices, which are very user-centric, but maybe fall short on the clinical side. And I think one thing that we try to do really hard is to address both sides of that coin.
New choices, new players, new models of care. You know consumer-first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer-first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Hey, welcome back to the leading podcast about consumer-centered health. We highlight innovators who are bridging the gap between sick care and well care, influencing change in the industry, and empowering consumers with cool new ways to engage in their health and wellness. We're also having some fun along the way. I'm Jared Johnson, and this is episode 456. Today, we have the flavor of the week about Amazon teaming up with nutrition care startup Faye. How can this partnership improve access to digital dietitian services, and what obstacles could stand in the way of adoption? I'll talk about that. Then Al Wu, Chief Product Officer at AliveCor, describes how to design personal health devices when consumers seem to expect everything on demand, how to keep clinical integrity without sacrificing consumer usability, and how the future vision of people-centric care is going from fixing illness to prevention. It's time for the awesomeness, y'all. Are you ready? Let's go. Flavor of the week. We might be able to learn a lot about where Amazon sees new opportunities based on its latest signal of where it's focusing in consumer health. According to Reuters, Amazon announced on September 16th that they're teaming up with nutrition care startup Faye to provide personalized insurance-covered dietitian services. The move makes Faye the first nutrition care provider on Amazon's Health Benefits Connector, which helps enrolled customers match with digital health companies for health conditions such as diabetes and musculoskeletal issues, as well as mental health support. Faye uses AI to match users with registered dietitians based on their goals and health history. So now dietitian visits are moving from out-of-pocket nice-to-have status to being integrated into everyday health benefits. Faye's algorithm works to match you to the right provider for you as opposed to a generic plan. This is the first time Amazon's benefits platform has addressed a nutrition care partner, which signals just how important preventative, lifestyle-driven health is becoming in the mainstream. For Amazon, it's another step in building a healthcare ecosystem that's not just about meds and urgent care, but also about long-term wellness. The company said it built its Health Benefits Connector as nearly 1 in 4 U.S. adults remain unaware of the benefits available to them, even when provided by their employer or insurers. Meanwhile, Faye recently raised $50 million in a Series B round led by Goldman Sachs, valuing it at $500 million. It operates a network of over 3,600 dietitians across all 50 states. What's the consumer lens? For consumers, it means one less barrier to accessing food guidance that could help manage chronic conditions, prevent future issues, and maybe even help you feel better day to day. Think about how often nutrition advice gets watered down into one-size-fits-all meal plans or gets hidden behind a paywall. Now imagine opening the same Amazon platform you always trust and finding insurance-covered access to a dietitian who actually gets your personal goals and health needs. But the real question is, can Amazon balance scale with personalization? Nutrition is deeply cultural and personal. If they can pull it off, this could normalize dietitian care the same way telehealth visits normalized video doctor appointments during the pandemic. As with the majority of consumer-centered solutions, there's a big risk that even when people learn about these benefits, they won't be ready to change their behaviors or they won't trust the process. Because if there's anything we've learned in healthcare, it's that it can be all too easy to do nothing. I do think that they'll quickly overcome that adoption barrier, especially if they find the right partners to tell their story. So as usual, I'm cautiously optimistic about this announcement. I can see their vision for improving America's health, and its adoption will likely come down to a truly consumer-centered experience and those consumers being correctly informed. Let's watch as Amazon expands its Health Benefits Connector offerings and makes further inroads into nutrition care with partners who are already proving their impact on society. That's another way that we'll build the healthcare of tomorrow, and that's the flavor of the week. Hey y'all, I'm here with Sina Arham, founder of Friday's Health. Sina, what do you think is broken in the traditional approach to metabolic health, and what are you doing to flip the script?
Let's be honest, the moment in metabolic health is being driven by the GLP-1 receptor agonist class of medications, right? We finally have something that is addressing metabolic health, obesity, and type 2 diabetes in an elegant fashion, right? It's efficacious, it's manageable for patients. And so I think we're having our moment in metabolic health in that the old guard of tackling metabolic health and obesity has a lot of stigma attached to it, a lot of shame and blame and guilt.
Thanks, Sina. Visit joinfridays.com for more information and tell them you heard about it from the Healthcare Wrap.
Healthcare Wrap is sponsored by Cyril. Whether you're trying to drive patient volume as a healthcare provider, boost membership enrollment as a health insurer, drive improved adherence rates in pharma, or deepen strategic B2B partnerships throughout the healthcare ecosystem, Cyril can help you with your go-to-market efforts and growth targets, enabling you to reach the clinical and financial goals of your healthcare organization. For more information, go to Cyril.com. That's CYRALL.com.
The flow.
All right, everyone, let's get into the flow. I'm here with Al Wu. Al is the Chief Product Officer at AliveCor. There are lots of different sides to wellness and just consumer sides of wellness and preventive care that we're trying to understand better. So I wanted to welcome Al to the show. Al, welcome to the Healthcare Wrap.
Hey, thank you very much, Jared.
You want to give us a quick context of who you are, what you do, a little bit about yourself?
Like Jared mentioned, my name is Al Wu. I'm the Chief Product Officer here at AliveCor. And what that means at AliveCor is I'm responsible for the product function. And what product does here is everything related to product definition, product roadmaps, design of the user experience, overseeing some of the services aspect, which is part of the product. That's all under the purview of the product team. I've been here for about, today, exactly 6 years. And before this, we're based in the Bay Area, Silicon Valley. So worked a lot of consumer electronics, was at Amazon with Alexa, and worked on other consumer electronics, semiconductors topics before that.
Fantastic. And then kind of along with that, for those who aren't as familiar, can you give us maybe a 2-minute introduction to AliveCor?
I think most people who have heard of AliveCor are probably most familiar with our Cardia line of ECG devices. So you may have seen ads for it on television. It's available on Amazon, Best Buy. What Cardia is, first and foremost, it's the ECG device that allows you to take ECGs at home yourself, wherever you want. But also, along with the device itself, there's clinical AI to help monitor your health. We offer clinical services for cardiovascular care. We provide connectivity of the data between you and your doctors. So really, we're focused on providing a set of products and services that empower users to take better care of their heart health. That's what we have on the consumer side. There's also an enterprise side as well, where we take some of the same technologies and repackage it for healthcare providers to remotely monitor patients and also for pharmaceuticals to do clinical trials.
So who's a typical user here and how are they first getting their hands on a AliveCor device usually?
So on the consumer side, there's a few different set of user types. I think probably one of the larger ones is the one that we call the seeker. So these are folks that may have some undiagnosed symptoms, who may be at high risk for heart disease, and they're looking for some way to monitor their health, but probably more importantly, detect signs of disease so they can shut out their doctor and get care. So these are folks that are, I'll say, more likely to have some problem at trying to find out what's going on. We also have a set called maintainers, those who have heart disease are using our product and our services to just keep tabs on it and make sure that it's not getting worse, hopefully getting better. And then there's kind of a third set that we call improvers. They don't have heart disease, they don't have the symptoms necessarily, but they're living healthy lifestyles and they just want to see the impact of the healthy lifestyles on their heart health.
So can you walk us through maybe what's typically like to use it, kind of what the experience is like?
Okay. So for a consumer user, typically they would purchase a device, and we have both single lead and 6-lead devices. For those who aren't familiar, 6 leads is kind of a more diagnostically valuable form of ECG than single lead. Typically, they would get the device. They could buy them at retail. They could buy from our website. They could buy from Amazon. And then they would download the app, create an account. And then there's a tutorial in the app that allows you then to start taking recordings immediately. 30 seconds, you get a recording. You also get some basic AI to see if there's signs of atrial fibrillation, for instance. And that is kind of the basic experience. For kind of more power users who are trying to get more out of their products, we do offer a subscription service called Cardiac Care, which gives them more advanced AI, gives them more access to data and insights where we actually package data up in more digestible ways for them, and also gives them enhanced connections to clinical care, to doctors, either whether it's their doctor or with doctors that are provided by us.
Nice. One of the things that we try to emphasize here on the show is helping all of us on all sides of care, but especially those coming from anything consumer based, is understanding how people make decisions, right? So even some of the options you just described there, how do you help kind of guide somebody who's like, I'm not sure which of these things makes sense for me?
Yeah, I think that's a great point. I mean, one thing we definitely try to do is not just say, here's your data, because data by itself is interesting, but it's not very actionable. So we do try to provide something that they can understand better and then act upon. So for that, we do have the AI, which gives them, I can't call it diagnosis because we're not allowed to call it that because only doctors diagnose, but we give determinations, which are very good. They can take their own doctors. We provide other insights based on their history of recordings. Like, for instance, if they have AFib a lot, that we can surface that very easily in the app in a very digestible, informative way so they know how to take that to their clinician. Also, we employ a network of cardiologists that are available in all 50 states where if they want a consultation with our doctor, let's say they have a question that they need answered right away, they don't have access to their cardiologist, we can probably fill that gap in and care for them as well. So we're really all about saying, here's your data, which is great, but I want to give you insights, give you the tools to make decisions on what to do next, and then also provide the mechanisms to take that next step.
Cool. Because when I think about how consumers, again, are just making choices here, and they usually tend to be self-qualified. It feels like they know they need some help. They know they need a tool. They know maybe they need some data. They need some clinical guidance. They need some help. And I feel like consumers' demands can just be so sky high, like with everything else, right? Something you're expected, they might just be like, well, I'm sure this is going to be the most amazing thing ever. So the demands just feel like they're always pretty high. And when you talk about the sick care, like the clinical care side of health, it's really hard to meet those demands of what consumer would expect with their experience. What's AliveCor doing in this area? Like, how are you kind of meeting that moment? How are you staying relevant? Like you said, you have to walk the line of like what this is and what it isn't, like diagnostically, so you can steer clear of things that make, like regulations that make sense and don't.
That's a very good call out. And you look at a lot of medical devices, they're clinically validated, they're FDA cleared, but they probably fall short on kind of the patient's needs. And then you look at a lot of wellness devices, which are very user-centric, but maybe fall short on the clinical side. And I think kind of one thing that we try to do really hard is to address both sides of that coin. A cardiac service isn't going to by itself solve someone's heart problems, but we can provide that bridge to care, whether it's care from us or care from their doctors. And a key part of that is getting clinician trust. That's why we are so focused on FDA clearances. We're focused on getting peer-reviewed studies out there that can say that our stuff works, so that their doctors trust that the data they get from us. The flip side is if we're not user-centric, like you said, meets their needs at the moment, retention, engagement will suffer. And if you don't use it, there's no impact. So I think for us, that is a really focus for us, is to kind of address both things, get clinical validity, clinical trust, but also make something that people find useful and easy to use. Because if you don't have both sides, you're not going to be very impactful in terms of driving better outcomes.
Hey y'all, I'm here with Jessica Holton, co-founder of Ours Privacy. Jessica, how do health systems know how much marketing data to track?
Know what you're optimizing for. We see and hear about a lot of teams that are tracking everything they possibly can, which you would think is more info is better, and we can make more decisions if we have more information. But actually, it just sends more data that is potentially PHI, and you have less control over it when you're tracking everything. Instead, choose 1 to 2 key metrics that you are tracking and focus on those metrics.
Thanks, Jessica. Visit oursprivacy.com for more information and tell them you heard about it on the Healthcare Wrap. Well, you really hit this on the head in terms of where a lot of devices seem to be right now, of trying to get both sides of that coin, of the consumer side and the clinical side. A lot of wearables really are one or the other first. They're wellness first, medical second, or vice versa. So it's kind of cool that like this is the thought process, right? Like this is very much a North Star in terms of what product actually gets out there on the market. On the clinical side, I would love to hear even more like how do you do that?
So the clinical side, I think we do a couple things. One is we make sure that ECG recording quality is great, right? So there's a clearance process, a test process to make sure that the ECG recordings that we capture are high fidelity, noise-free, diagnostic value. And then the other side is the clearance on the software. And I think one thing you mentioned is kind of that tension between speed and regulatory. One way we address that is we clear those separately. We get the device cleared for this recording integrity, and then we get clearance for the AI that goes with it, and that requires its own set of development, testing, validation, part of the clearance process. But the beauty of that is once we have those two clearances separate, that device is good, and we can continue to add on additional AI and software components as we get clearance. Now, since also the recording quality is validated, we can augment any gaps. Let's say we don't have AI for these conditions or these determinations yet. We can augment that with human doctors, clinicians. They're licensed, they're able to take diagnosis and readings. So let's say there's a condition we don't have the AI for yet. We can still provide value to the user by having one of our doctors or their doctor see that in the ECG because the ECG is good. And then as we get the AI cleared, we can just add that to the product. So we kind of managed to thread the needle or maybe navigate the speed that we want to meet user needs, customer needs, and also the rigor of making sure that the quality is good, the accuracy is good, and that we do not at any time compromise patient safety.
Okay, so that kind of makes, this might be a leap, but made me think of something here because I feel like cardiac care, short of metabolic/diabetes management, prevention, et cetera, cardiac care is just one of those types of care that feels like it's driving digital health innovation, right? It's not just kind of in the background. There are a lot of reasons for it. It seems like a lot of cardiac related conditions, everything from heart failure to AFib, like you mentioned, it just feels like everything's on the rise. Again, I don't have any clinical data in front of me, but it just feels like it. Maybe we're just hearing about it more. So are we at a tipping point where something like cardiac care can become a driver of even more digital health innovations, kind of like leading? Because in a lot of the ways you just described, I feel like it is. Like even just that ability to walk the line between clinical and consumer needs and regulations. So you have a device that when you put it in somebody's hands, they do want to use it and it works properly. Is there more to that? Am I just kind of like making a leap here?
Question of whether we're at a tipping point. And I think the answer is yes. And looking at some statistics, I think you allude to them, but I'll share what I know. In terms of costs in the US, and direct costs, cardiovascular disease represents about $350 billion annually. So it's a very expensive disease state. In terms of prevalence, cardiovascular disease is related to age, is related to lifestyle habits. There's a lot of comorbidities like diabetes and obesity. By 2050, an estimated 45 million Americans will be diagnosed with cardiovascular disease. So you see the demand for cardiovascular care is increasing. Now, look at kind of the flip side of who will take care of all these people. 80+% of counties in the United States, mostly rural counties, don't even have a single cardiologist. That's kind of frightening. The average age of cardiologists is 59. So you can imagine there needs to be a lot of new cardiologists to fill the gap as the cardiologists retire. So, the balance between supply and demand, I think, is pretty striking. And that is already pushing us toward the tipping point. I think to your point, that we're already seeing a lot of momentum in digital health for heart care just because the need is so acute for it.
Yeah, those numbers are staggering. The need, the supply and demand, the demographics. Yeah, it really does feel like, I think that could justify the thought of at least having a discussion about, are we at a tipping point? Yeah, that's a really good point.
I think you see that it's not just AliveCor. A lot of folks are addressing this problem with PPG monitors, wrist warrants. So I think a lot of people are approaching it from different ways, but I think the problem is very real.
What's next? What's that next evolution for AliveCor? You really helped define the personal ECG category. Is this a continued evolution to a fully fledged heart health platform? Is there more to come? Like what you're able to share?
We've come a long way already. When I started 6 years ago, we had a device and we had some rudimentary AI. And that's pretty much about it. I think today we offer more AI, we offer digestible insights, some of the what we call the post-recording options of what to do with your data. So I think we're already headed in that direction. Of course, there's always a lot more to do. I think one thing that we're working very hard on is to help, I would put this carefully, to help detect signs of impending cardiovascular problems. So they may not be here today. They may not show up in ECG today, but looking for ways to detect trends, to assess risk so that people can be more preventative. Because as you're preventing something, if you can prevent something, it's always better than treating it later on. So things that will say, look for signs of degradation across a set of ECGs over time and then flag that there is something of concern. That's what we launched in CardioAlert earlier this year. It's like, take your recording, and even if nothing shows up as in that recording as a cardiovascular condition, we may see trends in it that indicate that you should go talk to your doctor. And those are the kind of things that we're, for the consumer side, we're really working hard with, is provide insights that you can use before the fact and not after the fact.
This direction just has my mind going in so many different directions. We hear about Whoop right now addressing the FDA warning letter that they got saying, yeah, like in their case, their blood pressure insights feature needs to now go through the FDA regulation process. I honestly think like we're just at the beginning of this category for a lot of the reasons you just mentioned. The demographic need, the supply and demand challenges of traditional care, waiting till we need help. We as a society just benefit. I don't know if it's just because it's like an elephant in the room or if we just all assume that everyone understands it, but I feel like we can always talk more about the why here. Like, why are we trying to figure out how to be more preventive? What are the benefits to society, to our industry, to saving costs, to just saving individual consumers? It does come back to, clearly a consumer or patient who's using something, but that's the bigger picture here that I just kind of see. And it's just fascinating to think about because, you can take AliveCor here. You can say AliveCor very well is at the core of the future of cardiac care because of what the company's already done over all these years, and the devices that are out there now and the services are testament to that. Does that make sense in terms of like the need to just keep going here and any other insights there as AliveCor is working towards that?
I know AliveCor is not the only one working on this. This is not something that is solely the AliveCor topic. A lot of people working on kind of this vision. And I think the way I try to communicate it is there's a vision toward people-centric care. I mean, today, the healthcare system in the U.S. is not very people-centric. It's very centric to the healthcare provider, insurers. They decide what people do, what people get, what treatment they get. But in a future vision of people-centric care, I mean, you have a situation where today you're treating sickness, and in the future you'll be maintaining wellness. You go from episodic care, I'll fix something if it's broken, to continual care and hopefully prevention. And then kind of where we're squarely in today is taking what's opaque diagnostics. You go to labs, they get some tests, no one understands what they mean. And then instead of that, empowering people with transparent, people-generated data that they can use along with their care provider to make the best decisions for them. So that's kind of the broader vision. And there's a lot of pieces that go into that. But I think everything that we're doing is striving toward that future state.
I agree. I think that's where we're going. What gives you hope for the future of healthcare? We talked about kind of where things are going, but you personally.
I will hear stories about how product services like ours, not just ours, but like ours, are actually making a positive impact. And a couple that came up just a few months ago. Once there was an incident, I think it was in a flight from Uganda to Amsterdam, where a passenger was having a heart attack. And there happened to be a cardiologist on board, had his whole kit of equipment, determined that he was having an acute incident. And then this doctor happened to have a cardiomobile device with him. And he used it over the course of the flight to ensure that they can make it to the destination safely without having to turn around. And the guy landed after that, he was treated, but because of cardiomobile, he was able to keep tabs on this guy's condition over the course of the flight. And, that, I think it's inspiring that something is working. I think the other story is there was a gentleman in the UK, a relatively young guy, like 40s, who had for 20 years was having symptoms, palpitations, other heart symptoms that were never diagnosed. He picked up a cardio device. They used it, detected a case of SVT, supraventricular ectopy, took it to his doctor, got an ablation, and now he's recovering. But it was 20 years, never diagnosed because it was never caught at the moment, because ECGs are typically unmonitored outside of the clinic. So he got the care he needed finally. So when I hear stories like these, they're proof points that what we're doing is working. It's a long process. It's a slow process, but we're making progress. And I think the vision that we have is a valid one, and it's very achievable.
It's absolutely achievable. And I thank you for bringing those stories to light. They're exactly the reasons why it makes sense for us all as an industry to keep going this direction. Al, it's been a pleasure. Thanks for taking the time to share a little bit more with us today and for everything you're doing to make healthcare more people-centric, more consumer-centered. We look forward to keeping up with you and the whole AliveCor team to see what comes next.
Hey, thank you so much, Jared.